You've probably heard about Ozempic, Wegovy, and other GLP-1 medications. They're some of the most talked about weight loss injections today. You see them all over the news, social media, and probably heard about them from friends or family too. But here's what many people don't realize. These drugs don't just help you lose weight, they also directly affect your cardiovascular system. And depending on how you use them and what you do alongside them, they can help your heart or put you at risk if you're not careful. Some of these effects are incredibly beneficial, especially for people with type 2 diabetes or significant obesity. But some effects come with important precautions, things you really need to know if you're thinking about starting or stopping these injections. And the single most important thing about protecting your heart while using medications comes right at the end, so I encourage you to stay with me until the very last moment. Today I'm going to break down how these medications work, how they can help your heart, where you need to be cautious, and what you absolutely must watch to stay safe, plus the key takeaway if you ever consider stopping them. I'm Dr. John Chuback. I'm a board-certified cardiovascular surgeon. Let's get started. First, let's talk about how these medications actually work inside your body. Ozempic, Wegovy, and others like Mounjaro contain medications called GLP-1 receptor agonists. And in the case of Tirzepatide, it also works on GLP receptors. Now, what does that mean in plain English? These medications mimic natural hormones your gut produces after you eat, mainly GLP-1 or glucagon-like peptide 1. This hormone helps tell your brain you're full. It slows down how fast your stomach empties. It makes you feel satisfied sooner, so you naturally eat less. They actually change how your gut, brain, and pancreas talk to each other. And because your gut, blood sugar, and heart are all deeply connected, these drugs can have big effects on your cardiovascular system too. You may be wondering, Doctor, if I lose weight on Ozempic, does that automatically mean my heart's safe? And my answer is always, not automatically. The weight loss does help, but you need to understand how it helps and what else you have to keep an eye on. Let's talk about the good news first. One of the biggest benefits of GLP-1 drugs, when used correctly, is that sustained weight loss reduces the workload on your heart. Think about it this way. When you lose weight, your heart doesn't have to pump blood through as much tissue. Your blood pressure often drops, your blood sugar control improves, which lowers your risk for damage to blood vessels over time. In fact, large clinical trials like the SUSTAIN 6 trial and the LEADER trial have shown that for people with type 2 diabetes, using GLP-1 drugs can reduce the risk of major adverse cardiovascular events, like heart attacks or stroke. So in the right patient, especially someone with type 2 diabetes and obesity, these drugs can be a powerful tool for protecting the heart when they're part of a comprehensive plan. But, and this is really important, these medications come with real medical risks you need to understand. One issue is rapid weight loss, which often causes gastrointestinal side effects like nausea, vomiting, or diarrhea. In plain language, that means you might feel sick to your stomach, throw up, or have loose stools, and all of that can cause dehydration if you're not careful. Severe dehydration can lead to acute kidney injury, or AKI. That's when your kidneys suddenly can't filter waste properly, which sometimes needs hospitalization or even dialysis if severe. Rapid weight loss can also cause cholelithiasis, which means gallstones, and that can lead to cholecystitis or gallbladder inflammation, and in some cases, pancreatitis, which is very dangerous inflammation of the pancreas. Another issue I see often, patients feeling better after losing weight and decide to stop their statins or antihypertensive medications, meaning cholesterol or blood pressure drugs, on their own. Doing that without medical advice can quietly raise your heart risk again. So watch your progress, but don't ignore these risks, and always stay in touch with your doctor. People on these medications may come in feeling great after losing 20, 30, or even 40 pounds, and they think, I don't need my cholesterol or blood pressure meds anymore, doc. But when we check their labs or repeat their heart scans, sometimes the risk is still there. So always talk to your doctor before stopping any medication. So what should you watch for if you're using or planning to use a GLP-1 drug like Ozempic or Wegovy? Number one, if you feel new chest discomfort, unexpected palpitations, or sudden dizziness, don't brush it off. Call your doctor immediately. Number two, always use these medications under proper medical supervision, especially if you've already had any form of heart disease or if you've had a heart attack or a stent placed in the past. And remember, these injections work best when you combine them with real sustainable lifestyle changes. A healthy diet, regular movement, stress management, good sleep, all these amplify the benefits and protect your heart for the long term. So here's my quick tip for you as a cardiovascular surgeon. If you're considering a GLP-1 as weight loss therapy, whether it's just for weight loss or for diabetes, make sure your cardiovascular health is being monitored too. Don't focus just on the number on the scale. Look at the big picture. Your blood pressure, your cholesterol, your heart rhythm, your inflammation. That's what keeps you safe. And don't click away, because the single most important fact you need to know about your heart and these medications is just a few seconds away. Here's the most important thing to remember today. Studies show that stopping GLP-1 medications without a plan often leads to weight regain. And when that happens, when the weight comes back quickly, your heart disease risk can go right back up. That's why long-term heart health depends on keeping the weight off with real, sustainable habits. Eating better, moving your body daily, managing your stress, getting good sleep, and having regular checkups with your doctor. The injection alone is not the answer. It's just one tool in a much bigger toolbox. Thank you for watching. If you found this helpful, please share it with someone who's thinking about these medications. You can help them make a safer, smarter choice. Drop a comment below with your questions. I read every one, and I try to answer as many as I can. And don't forget to subscribe for clear, real-world medical information. I appreciate you spending this time with me, and I'll see you in the next video.